Hearing loss is classified into 5 major types. First, conductive hearing loss, sensorineural hearing loss, mixed hearing loss, neural deafness, central deafness. Okay. So what is a conductive hearing loss? From the ear hole till the stapes bone, the last part of the stapes bone, if sound amplification is reduced because of some reasons like wax accumulation or eardrum perforation or pus accumulation or the bones getting cracks or the bone is broken. Okay. If sound conductivity is reduced because of these reasons, that is called a conductive hearing loss. Sensorineural hearing loss. Actually, sound is a conductive mechanism. Okay. Whether it transfers through air, whether it is transferred to water, whether it is transferred to solid particles, sound is conducted by these 3 medium. Okay. So what is the sensorineural hearing loss? The word sensorineural hearing loss is most misunderstood concept actually. Okay. The sensorineural hearing loss is nothing but if sound conductivity has some differences, because of that the sound is either poorly amplified or not at all amplified, okay, into the cochlear. If a sound amplification has to have some difficulty or any differences of amplification occurs because of the status inside the cochlear, that is said to be a sensorineural hearing loss. Sensorineural hearing loss. So what is a sensorineural hearing loss here? So imagine the sound is conducted inside, the eardrum moves and then it is amplified to the bone and then to the cochlear. Okay. Inside the cochlear, the sound has to travel inside the perilimb and then endolimb and then over the hair cell and then it has to come outside via the perilimb part of the cochlea through the round window part of the cochlea. Okay. So in this process, if some differences occurs, because of that the sound amplification is reduced and the signal is poorly formed or not formed, that is said to be a sensorineural hearing loss. So I keep on encouraging the patient to ask questions on what is the types etc. to either to me or other doctors, just to make them enlightened to know what is what. Okay. Sensorineural hearing loss is nothing but the sound amplification getting reduced inside the cochlea. Okay. So that causes the clarity issue. The patient used to say that, sir, I sense the sound but the clarity is not there. I can able to sense the sound. What we people used to think hearing loss is the type, if a patient thinks that he is having hearing loss, we thinking that they don't hear anything. Okay, it's not the case actually. They will be hearing the sound but clarity will be missing. Okay, the sensorineural hearing loss is not a neural hearing loss. In case if it is a neural hearing loss, even thunder sound or bomb blast sound one can't able to sense. Okay, so that is the issue here. Don't get carried away by the words that it is a sensorineural hearing loss, you have to put hearing aid. Okay, it is a nerve issue, you have to use hearing aid or you have to take this tablet to strengthen the nerve. The problem is not with the nerve, and why should I take the medicine? Nerve strengthening tablets. So that the people has to think on it. Okay, don't get carried away that you have to do it immediately, you have to buy the hearing aid immediately or the residual hearing condition will go out. Don't believe in such stuffs which are unscientific. Okay, using hearing aid will further put the pressure over the cochlear and further reduces the hearing capacity. Okay, so that is the issue here. The third condition I am talking about the mixed hearing loss. If a patient is having both conductive hearing loss and sensorineural hearing loss, that condition is said to be a mixed hearing loss. The fourth condition is called neural deafness. So imagine there is a switch here and it's having a circuit and there is a wire and there is a bulb here. Okay. If I on the switch, the current passes through the wire and makes a LED bulb on. Okay. So if switch is off, current is not going to pass in the wire and the bulb is not going to on. Okay. That is the scenario here. So switch is on, but the wire is being cut. If the wire is cut, what happens? The current doesn't passes, so bulb doesn't burns. Okay. The same way, the neural deafness is a condition where the nerve path have some obstruction or the cut in the nerve. That is called neural deafness. And fifth part is the central deafness. So imagine the same circuit here again. There is a switch here and the wire is there in place and a bulb is attached to it. If a bulb is having an ignition issue, if the bulb is having some problem, it doesn't burns. Nah? The same way, if I on the switch, the current passes through the wire, but bulb doesn't burns. In that condition, the same way, the hair cells move and create a pattern in the wire. The same way, the wire sends the signal to the bulb, but bulb is not in a position to burn. The same way, if problem is in the auditory part of the brain, if the problem is in the auditory part of the brain, that is called as a central deafness. For the last two conditions, that is neural deafness or central deafness, in our hospital we don't have any treatment at all. But for neural deafness, modern medicine has a treatment called ABI, auditory brainstem implant. In the neural deafness, where the nerve is cut, or in conditions like the cochlear is not at all formed or cochlear is poorly formed conditions, such a treatment option has been advised. So, in case someone says that it is a nerve problem, and in case if someone says it is a nerve issue and tries to advise you to say that you have to use hearing aid, you straight away ask them, if it is a nerve issue, how can a simple amplification of sound can able to help? Because a hearing aid doesn't do more work. Its work is to amplify the sound. Okay. Just an amplification of sound is not going to help in any form if the nerve is having an issue. Okay. I have already said, if it is a neural deafness, even thunder sound one can't able to hear. But if you have done a successful treatment under ABI, it is possible. Okay. But in case if it is a neural deafness, no hearing aid is going to help you in any way. Okay. So don't put all the eggs in same one basket and say that the sensorineural hearing loss is a nerve problem, conductive hearing loss is a nerve problem. It is not like that. Okay. So you if someone tries to hurry you up or tries to force you to take a decision, okay, just stand away from them. Think. Provide some time for you to get enlightened. Okay. And take a meaningful decision. Okay. After all, we are the one who is going to decide. So, for example, Imagine a fellow is having a leg pain. He goes to a doctor. Sir, from morning I have a leg pain. Okay, doctor, without testing anything, he just says, okay, you cut your leg. Yes, said. So, does the patient will cut the leg since because doctor has said, na? Is it necessary? No. First, you have to check your condition. What type of problem? Why it came? How it came? What are the available solutions? And take an informed decision. Okay, not only by giving a word by a doctor's mouth is going to be the highest verdict. It's not like that. Okay, so take a decision which is an informed decision. Okay, try to ask the question yourself or to your doctor. That is very essential. Okay, so in case there is a single mark of a sound conductivity in the audiogram, it is not a neural deafness. A single mark, any mark, either in a bone conductivity or an air conductivity, if some mark, if a patient hears something as a sound, it doesn't, you can straight away say it is not a neural problem. Okay, if you hear something as a sound, it is not a neural problem. Okay, so that is the situation here. You have to understand about the issue. If someone says it is a neural problem and you have to use hearing aid, please ask them, sir, you kindly give a medical declaration stating the same that I have a neural problem. But they cleverly write it as a sensorineural hearing loss. They may say anything, it is a nerve problem, etc. on oral. When it comes to medical declaration, they never give. Okay, because they are entitled to answer for that. So, neural deafness is different, sensorineural hearing loss is different. I use the word correctly. Sensorineural hearing loss, conductive hearing loss, mixed hearing loss. It is a hearing loss. The amplification is reduced. Okay, here I use the word neural deafness, central deafness. That is different. Okay, hearing loss and deafness is entirely different. Okay, so try to understand about the condition. Don't get hurried away and don't get carried away by the statements that you have to use hearing aid, etc. The hearing loss is of totally 5 types: conductive hearing loss, sensorineural hearing loss, mixed hearing loss, neural deafness, central deafness. Okay, so try to understand what is the condition. Okay, the central deafness and neural deafness are less than 1%. What is that? It is less than 1%. It's very rare. Yeah.